What is TMJ, TMD, and CCMD? Sometimes that is confusing. Most people, that includes many dentists, refers to TMJ as the problems with the jaw joint. This is where the mandible, which is the lower jaw, connects to the temporal bone of the skull. This joint is the TMJ. Problems with this can include popping, clicking, grating, pain in the joints. That is often referred to as TMJ or TMJD. TMD, Temporo Mandibular Dysfunction, refers to more than just the jaw joint. When the muscles that move the jaw, jaw joints, and teeth, if they don't work in harmony, dysfunction ensues. It is the dysfunction, poor function of the mandible, the jaw, that leads to tight spasm of the muscles and also problems with the jaw joints, as well as bone loss and other problems with the teeth themselves. And yet, dental schools even today teach dentists that painless clicks, joints that pops and clicks but cause no pain, are normal and no treatment is needed. Yet, no ethical dentist would say painless cavities, painless caries are okay, they're normal, leave them alone that it hurts, until that hurts. That would not be ethical. And yet, dentists are still taught to this day that TMJD is primarily a biopsychosocial problem caused by stress. One of my patients, who is a board-certified orthopedic surgeon, said if one of his patients has a hip problem, he doesn't refer them for counseling to manage stress. He fixes that hip joint. Let's say if you're in a hotel room, you try to close a door. If the door isn't quite well aligned with the door frame, most people will just slam it really hard and push it to close the door shut. No one will say it's a perfectly fitting door, but if you keep slamming the door a couple of thousand times a day, eventually something bad will happen to the hinges. Of course, in this analogy, upper jaw is more like a door frame. The maxilla, the upper jaw, is part of the skull. Lower jaw is more like a door. If it doesn't quite meet right, the muscles that move the jaw will do whatever it takes to make the teeth come together. This is what dentists call bite. When they put a ribbon between your teeth and go tap, tap, tap to mark the bite occlusion, they mean where the teeth come together. But in fact, oftentimes where the alignment of the lower jaw to the head is quite different from where the teeth meet together. Just as a door hinge eventually starts to wear out and fall apart, the jaw joint over time, because of the micro trauma of making the teeth come together, the disc can slip out, leading to popping, clicking, and eventually even bone against bone, rubbing against bone, arthritis, and so on. But long before it became a joint problem, it really was an alignment problem, hence the term temporal mandibular dysfunction. In fact, the jaw and the upper part of the neck work together as a functional unit. When we open our mouth really wide, the head rotates back, somewhat like this. This is the bottom of the skull, called occiput, and the first vertebra is called atlas. They work together. This is where that movement happens. In fact, what affects the jaw affects the upper part of the neck. It can affect the entire postural chain. Hence, a better term would be CCMD, Cranio, Cervical, Mandibular Dysfunction. The poor function and alignment of head, neck, and jaw. That is CCMD. The protocol we developed around 2006, called Raman CCMD protocol, strives to get the jaw, upper part of the neck, and all of its entire alignment of the postural chain aligned better as a starting point of diagnosis and treatment. This has been shown to be effective in resolving even chronic whole body symptoms like fibromyalgia and general anxiety disorders over 93% of the time, very quickly.